Dr. Mitchell, it's great to see you. Thank you for coming in for an interview.
Great to see you, Lonnie.
Yeah, and it's always good to see you. And as many times we've had a chance to work together, you're someone who does research in the department as well as clinical care, and I know that your patients are always very grateful in terms of the care that they receive from you. We haven't had a chance to sit and ask these types of questions like I've been doing with other faculty, so interested to hear from you on some of these. So to start, as you were going through and you're getting a lot of education and really good universities, and obviously, had ability to do many things you could have done in life. What made you decide to get into medicine and science?
So I've actually always been interested in medicine, probably from the time I was about 5 or 6. My family emigrated here from Ghana when I was around 4.5, 5 years of age. And my mom, who had been a teacher back in Ghana, came here and decided to go to nursing school. And so I was probably in about kindergarten, first grade when she started nursing school. And back then she could bring home cadaver pieces to the house. I know it sounds gross, but I thought it was cool as a little kid that she'd bring home like sheep's brains and other things like that. And I thought it was awesome. Wow. And I know it sounds a little strange, but I thought it was cool. And so I would sit there with her. I'm doing my, first grade kindergarten homework, and she's doing her, nursing school work and learning anatomy and things like that. And so I would sit there next to her, while she's doing her stuff, I'm doing my things. And that's where my interest in medicine peaked. So, wow. Yeah, so it started when I was pretty young. So I knew I wanted to be a doctor probably from the time I was in probably about first or second grade.
Wow. Not everybody says that I've talked to. It's interesting. But that's great that you achieved your goal for sure. And in quite an impressive way. So you are someone who, in addition to being a clinician and working with patients who have problems with, the optic nerve and damage in the way back in the eye and the connection between the eye and the brain, you also do research, and some of your research is very interesting. So I'd love to give any of the audience here a little bit of a sense for what you do in terms of research and your interest.
Sure. So I have varied research interests, but one of the areas of interest that I have been working on in the past has to do with substitution vision, working with patients who have, specifically pediatric patients who have lost vision at young ages for various causes, and using devices to try to help them navigate their world, so to speak, not necessarily give them their vision back, but allow them to be able to perceive the world around them from even though they've lost their sight. So that's some of the work that I have done in the past.
So, and I know that some of those devices and some of the kids that I've actually got a chance to see, it's very remarkable what can be done with sensory substitution devices. Is that field still really expanding and growing?
It is, and there are newer devices that are coming on the market, and there are devices that we are looking forward to researching in the future to see if they are better applicable towards children. So, because children, they can be a challenge when doing research as far as holding their interest, and something that's user friendly for them. A lot of research that's done is more geared towards adults, and devices that are developed are more geared towards adults. So it makes studying devices on children challenging. And so we're looking into finding, substitution vision devices that are more pediatric friendly.
Interesting. Well, you've accomplished a lot. You've certainly done a lot with your education and taking care of many patients. But if you were to identify just one thing for us that you would say that you're just the most proud of in terms of your accomplishments professionally, here or in the other places you've been, what would you identify that to be?
So I wouldn't say that it's a specific accomplishment. I think it's about how I treat people. I try to treat everyone like their family. And I think patients really appreciate that, and they continue to come back for care because of that. And so I think if we as clinicians and providers, try to look at each patient as if this is a family member I'm trying to take care of and help, then it would make the patient experience so much better, and have patients have a more enjoyable experience. Sometimes, diagnoses that I have to give aren't good. They're sad,
Right.
telling someone that they've lost vision permanently, that their vision isn't coming back, there are times where, this gets it's an emotional time for a family. And so if you can be there for a family and treat them like family, I think it makes all the difference in the world. And so I think one of the things I'm most proud of is the way that I treat everyone that I come in contact with.
Oh, that's fantastic. So now you came in 2009 to start your fellowship at the
Correct.
University of Pittsburgh, and this is in pediatric ophthalmology. So you had to make a decision to come to the University of Pittsburgh, and then you were offered a position to stay here. So obviously something must have been attractive to you in terms of the University of Pittsburgh and the medical center, and tell us what was the driving force for you to, one, come, and then also have the opportunity to stay and stay in Pittsburgh.
Okay, well, so I have to be honest, my husband's from Pittsburgh. And so
Ah.
So I have some Pittsburgh experience. We actually met here when I was a medical student doing rotations.
Oh, I
And
forgot that. Okay.
so we already had a Pittsburgh connection, even though we weren't living here at the time. And
Mhm.
so when it came to look for fellowships, Pittsburgh was one of the places that we were interested in coming to. And then when I was here and I saw the culture here in Pittsburgh and University of Pittsburgh in the medical center, and the how everyone worked as a team in the pediatric ophthalmology division, it for me was a no-brainer. When the opportunity to stay was presented, I was just like, yeah, I mean, I love the people that I work with, and the team has changed since I joined on,
Mhm.
over 10 years ago, but I still love the people that I work with. It was one of the things that keeps me here.
Fantastic. Well, you know, you're you're doing a lot. There's certainly a lot of things I know that you probably hope to accomplish. But what really gets you excited about the opportunities that we have to do, and that you can do specifically in terms of the academic and medical work that you'd like to do in the future?
So I'm excited about, some of the research that's being done here within the department, some of the basic science research, and, as far as like, nerve regeneration and things like that. And the work that's being done as far as, vision rehabilitation through our retina department too. I think there's really some exciting work that's in the pipeline that's really going to put this the eye and ear and our work here on the map,
Mhm.
not just here nationally, but also internationally. So I'm really excited to see where things are going to go. And I'm also excited about, the new building that we'll be getting, that will help advance the work and the research that we're doing.
Well, terrific. Again, it's always so nice to see you, and it's so nice to get a chance to catch up on things. But thank you for helping and sitting for the interview today.
Oh,
Um,
thank you for having me, Lonnie.
okay, you take care. Have a great day.
You too.